Up next, we have our first panel discussion for the day. The panel explores a question that we don't talk about enough. What role do men play in making gender equity possible? From family support to workplace inclusions, the conversation starts here. Moderating this panel, we have Dr. Shraddha Kale Kapale, Associate Director of Myna Foundation, Mrs. Smriti Irani, Cabinet Minister, Government of India between 2014 to 2024, and Chairperson, Alliance for Global Good, Alessandra Verna, Professor of Economics at Stanford University and Senior Fellow at the CEPA Center, Zubeda Bai, CEO of Grameen Foundation, and Anshul Tiwari, founder and CEO of Youth Ki Awaaz and Center for Public Insights. Please welcome all our esteemed panelists.
Good morning, ladies and gentlemen. I am Shraddha, and I'm here to present the panel discussion on championing women's agency, health, and family support, role of men in caregiving. So when I truly think about what actually supports women's economic empowerment, I think more than offering job opportunities or policies, it's more about what happens behind the doors, like, in the everyday dynamics of our homes. So with one such powerful example, through our work at Mahila, what we do, we work with low socioeconomic strata of women there. And it's so to give you all a context, we work in an area where hygiene is really poor. And what do you call, I'm sorry, I'm just too nervous to talk. There's such big panelists here and Smriti ma'am here. And so I'm just...
Breathe. That's why I made sure I sit 3 seats away.
So I think I have everything in my hand, and yeah, okay. So opportunities of paid work, it often happens behind the closed doors and everyday dynamics of our homes. So most powerful examples come from my own experience in Mahila, where we work with urban slum community women. And the hygiene here is extremely poor. There is shame and stigma around the topic. And it is really difficult for a woman to speak up about her own issues and speak up in their own household settings, right? So there were many women who would come up to us and tell us that please do talk to our husbands because they just don't get it, that we need support. And while we realized that we are supposed to work with the husbands and have interventions around it, and we also had initiatives and programs around it, but we also realized that it's more important to work with the women and help them to help themselves to speak up more confidently in their household settings. So while we're working this, and we had programs around how to speak more effectively, clearly, and also being polite. So while women learn all of this, they gradually started taking small steps, and we saw this impact in the households where women used to not tell the husband directly, oh, come over and cook the whole meal for us. They would take small gradual steps like, oh, could you help me wash the dishes today, or wash the rice today. And it's because it's more of a partnership and not make the men look inferior, because the power dynamics are also very strong. So one fine day, one Sunday, the Myna trainer happens to go for a follow-up session in the community, and one husband just turns up and he's very proudly telling the Myna trainer that, ma'am, I now do the dishes for my wife in those days of the month, referring to the periods, very proudly. And then Myna trainer, of course, appreciated him, and then he left. And when the follow-up session started, the wife says, if that's what I get during the periods, I would love to have it every day. So yeah, but that brought a deeper conversation of how effective and clear yet polite communication helps, bringing in role of men in the household responsibilities and caregiving. So we realized that very soon, and we are, having programs around it. So when men enter It just doesn't give time to women, but it it just doesn't reduce the physical strain, but it gives time to her to have more opportunities, grab more opportunities, learn more skills. Um, Even if she wants to rest, I think it just buys her time. So it's not just about reducing the physical strain, but it's also about empowering her, not just economically, but also taking care of her own health. So yeah, drawing from this, Professor Myna, I have my next question for you. So based on your research, what does the current data tells us about the links between the role of men in increasing women's agency? Where do we see the strongest correlations and where are the gaps?
I'll just begin thanking the organizers for this amazing lineup, and I'm really honored and excited to contribute to this debate. But I'll jump right into this fascinating and important topic, which touches upon the fact that decisions about work are done by families, and families are many components, and these components have different opinions, are subject potentially to different norms, different incentives, different preferences. And so thinking about decisions around work, both whether, say, a woman should work in the market for pay and how much she should work, requires necessarily thinking about the organic decision-making that happens at the level of the household. And research has emphasized, I would say, two important areas of gap that are relevant for different populations. One that has been discussed already to a wide extent this morning, which is the notion that in many countries, this is definitely, we know from the data, the case in South Asia, female labor force participation tends to be relatively low and potentially a source of slowed growth, limited agency for women, more limited economic and financial independence. And the other one is that even when women work, and this is true everywhere, they still often do not achieve the same levels in senior leadership positions as men tend to do. And, recently, even in the US, we celebrate the fact that 10% of CEOs are female, right?
Yeah.
And so with this background, the use of time and the division of labor within the household has been highlighted for both of these domains to be extremely important in influencing what type of labor market participation and employment hours margin women make. I was just looking at some numbers, for example, from India, from the Indian Time Use survey, where women tend to spend 10 times more of a percent of their time on home production responsibilities than men do. But if you looked around the world, this pattern will arise over and over again. Women are obviously much more involved in the care. If you look now at research that has tried to understand why this is happening and what can be done to more equally distribute the care within the household, a theme that we've discussed a lot this morning emerges over and over again. And this has to do with traditional gender roles and the important role that norms play in characterizing how we act. And so since you've been asking about what research tells us about what's promising in leading to a more equitable division of this labor that then can open up time, both in terms of pure hours, but also mental time. We talk a lot about the mental load and so on. I don't have extremely positive answers, but I have something hopefully reasonably optimistic, which is obviously changing norms is extremely, or influencing norms is extremely challenging. What appears to be somewhat more promising are interventions that target the youth. So I'm thinking about the work, for example, of Professor Seema Jayachandran and her co-authors targeting adolescents in India with school-based interventions. But also, say, emerging work from Europe on paternity leave. So paternity leave doesn't necessarily change so much the way in which couples, at least this is emerging research from Spain, suggests what couples are doing, but it really changes what the children are seeing their parents do, and it's affecting them possibly long-term, how they see the role of men and women. So it's a more difficult battle to fight in the short run. It's more of a long-term investment that needs to be made by all the actors that we've discussed this morning. Finally, I'll just discuss briefly something that touches upon also what Professor Pande and Prilaman were discussing this morning, which is the notion of perceptions of norms. I've been involved in data collection in 60 countries, soliciting opinions and also perceptions of both whether women should be free to work outside the home, among opinions of both men and women in a representative sample, and also whether government and firms should be giving priority to women when hiring for leadership positions. And what emerges, particularly very strikingly for India, I would say, but we see that very clearly there, but in many countries of our sample, is that there is a very strong tendency to overestimate the degree of conservativeness on these matters. That, for instance, in our sample, more than 80% of our respondents supported the notion that women should be free to work outside the home. Yet they only believe that around 60% of others in their country agree with that statement. And in particular, it is men's views that are the most stereotyped. So men tend to be more conservative than women, but we tend to think that they're much more conservative than they truly are. And so potentially interventions that can promote dialogue around these matters that can be done at many levels can help bring men more into this conversation.
Also, I feel environment around the woman also plays a lot of role, like which environment she's been brought up in. Like if she sees other women around her doing the same kind of thing, and then rather having a role model which inspires her more to take it up. Yeah. How do you see men's involvement or lack of it in caregiving, household decision making affect the women's health outcomes and workforce participation?
So I would say research is emerging about the importance of, in particularly I would say for the second aspect, which is helping women achieve more equitable careers more similar to the ones of men, but also to some extent also the mere entry into paid work. That care responsibilities are really an important factor of limitation. And in terms of the implication of that for health, for example, we start seeing some evidence that, going back to the paternity leave discussion, and not today we'll talk a lot about maternity leave, but obviously paternity leave is also quite important to level the playing field potentially, but appears, while it seems to have more limited effects on work, and this is again research coming from Europe, so obviously with all the necessary caveats, it does appear to bolster and support women's health in a very critical time. So I think we're starting to see some empirical evidence suggesting that when women can access a more equitable distribution of family responsibilities, their health benefits as well as their employment opportunities.
Yeah. And what additional data or research would help us make an even stronger case for policies or programs that address the role of men in increasing women's agency? As I've mentioned, we start seeing more research that helps us understand what the role of norms is in shaping female employment and agency. I think more could be done in terms of exploring what promising channels can be leveraged so that we don't have to hope that in 30, 40 years, when the children of today have grown up, we can see change, but we can see more immediate change. And so one notion that I think, for example, is quite fascinating is almost 70% of Indian respondents in a recent survey argue that children might suffer if their mother work. That's from the World Value Survey. We see that again in many contexts. We know much less about what people think, whether people think that children might suffer if their father works or if their father doesn't work. I think thinking more about the role of fathers in child development and highlighting how important it has been and it is might be a promising avenue as well. Yeah, that's great. So with that, I'd love to turn to the only male panelist here today. So Anshul, you work extensively with India's youth. What emerging attitudes or behaviors do you see among young men regarding women's agency and shared caregiving responsibilities?
Thank you. Thanks a lot for that question, Shraddha, and congratulations, Sohani and team, on this amazing, conference. Very happy to be the token male on the panel. Definitely need more of that. I think so. Just for context, I run Youth Ki Awaaz, which is a citizen media platform. We have about 200,000 people every month who are writing and sharing stories, their lived experiences across multiple issues. Women in the workplace is one such issue. And as a part of the center that we run, we do a lot of rapid surveys to understand on a day-to-day basis what people are thinking, particularly about women's participation in the workforce. I think there are a couple of things that we've sort of noticed, which others have, of course, talked about, quite a bit already. But just to reiterate on some fronts, one thing that we've noticed about young men's attitude towards, women in the workplace is that young men are actually very conflicted, and I think it's very important to highlight that. And they are conflicted not just because of the fact that there is, of course, patriarchal norms around them, around their upbringing, etc. But they're also conflicted because they're seeing these conversations happen, but they're also wondering how is it that they can actually participate or they can help when they're actually growing up in a culture that discourages it, through and through. What we've seen in a lot of our data is that in a very recent survey that we had conducted was that 37% of the men who participated in our survey, they said that they've participated in household responsibilities, in sharing household responsibilities. But when we went deeper into what that really meant, it sort of showed what one of the examples that Shraddha that you gave was that it's a couple of days in a month, or 2 days or 3 days in a month, which makes it seem like I'm doing my share and that's enough. That's enough participation from my side. The second thing that we've seen is that there is a very severe lack of relatable role models. So what I mean by that is that you'll find a lot of men who are, say, extremely popular celebrities who are really, talking about the fact that we need more women in the workplace, we need men participating a lot more in the household, but they're not as relatable. They are not talking in the language, in the literally the literal regional language, for example, in many cases, that we need to have these conversations in. They are not culturally contextual for a lot of men, who are actually able to have some of these conversations as well. And the other very important aspect that men themselves highlight is the cultural permission, so to say, that is given to them to participate, a lot more actively in household responsibilities or in a lot of the kind of, pressures that men themselves face. There is a lot more conversation around men needing to be the, financially successful out of the say, in a relationship, for example. And that has a very direct influence on how men are looking at the workplace in general as well. What we've also noticed is that, of course, there are a lot more women who are very proactively having a conversation about this. But social media, for example, is playing a very big role in creating communities of men that agree with each other very quickly on aspects of the fact that, we need to be more financially successful, we need to have a certain kind of a job, women don't necessarily need that, and so on. And social media is not built for a very equal conversation. The algorithms are not built to encourage you to have sort of a much more diverse perspective than you currently do. So I think there is a lot of that we're noticing as well. Generally, what we've seen through a lot of our data is that agency for women is also being shaped by social permissions that women are being afforded, in families and so on and so forth. And what often happens is that the treatment that you're getting in your house because of your household responsibilities and the treatment that you're getting at work, because of your workplace responsibilities, the understanding between these two, segments of your life does not really exist. So your workplace colleagues, your bosses may not necessarily understand what challenges you're facing at home and vice versa. And that is also leading to a lot of dissonance in terms of, not just the initiation of participation, but the longevity of a woman in the workplace, as well. So yeah, broadly, that's sort of what we've seen through our data in India as well.
So Anshul, Youth Ki Awaaz has gathered over 1 million data points on young people's aspiration and challenges. How can researchers, policymakers, and employers use these insights to better tailor interventions or job opportunities for women?
I think first thing is a lot of these data points indicate towards cultural norms, something that we've all spoken about. I think everybody has spoken about, as well. I think there is something to be said about understanding lived experiences of young men and women both. So of course, going beyond pure data points and trying to see what cultural contexts exist where, in a country like India, but not just in India. I think it's a global phenomenon, especially in the global south. I think we do need to pay a lot more attention to these lived experiences. That's the first thing. And I think that's what we probably need to create more urgent behavior change campaigns or whatever there might be. The second thing that we've noticed is that a lot of this data can help us create very phase-specific intervention. So what I mean by that is that, in one of the surveys that we had conducted with young women, 72% of the women who are already in the workforce, they mentioned about the biggest barriers in the workforce for them being at the promotion stage. Where they're noticing that, they are not getting promoted versus a male colleague and so on and so forth, even though they've put in the same effort, they've had the same outcomes, where I feel like, what that tells us is that there is a specific moment in a working woman's journey where an intervention potentially needs to be created as well. The third thing, that we've noticed is that is around pay. So pay, we've noticed is not just the only problem. Agency around how you're spending the money, how much you're getting to access is also a big issue. So I feel like pay equity, role clarity, those are areas of intervention, where interventions can be created. And of course, the last sort of aspect that we've noticed is that we need to create, this is the conversation to be had a lot more with men. And the way to be having this conversation is to not sort of go to men and say that, hey, you need to start thinking differently, because that's not going to happen. In fact, what we've seen over and over again, we've done a mapping of podcasts, video series, films where there has been a direct conversation with men. Somebody has tried to tell men, you should not do this or you should not behave like this. The biggest consumer of such content is actually women. It's not men. So I feel, and this is across the board. So I think we need to, find a way to have these conversations with men, probably in a way that men will feel like, okay, I'm a part of this conversation, I'm in the room, I'm willing to understand and so on, which is I don't have a solution for how to do it. It's been a challenge for us consistently, but yeah, I think that's probably where one can get started.
Yeah, I completely agree. I think what I've also seen is women sometimes are the barrier for themselves when they learn to effectively communicate. And of course, like, men are not like stone-hearted or anything, right? They also have a heart, but it's just that it's two different gender roles altogether. Sometimes it's more like, inko samajhta hi nahi. They don't understand. Why don't they understand? That's what I've seen, especially from the context where I come from. So why they just don't understand? And sometimes we just have to give it back to the women that, maybe you need to communicate more effectively for them to understand.
I just want to say one point, which is that so in our work, what we've realized is that the onus of this conversation should actually not be on women. Yes. I think men need to talk to men. And I think that's a very important, because otherwise, regardless
but then we need to have more role models around it to start this conversation.
For sure. Yeah.
Okay.
I'm waiting my turn peacefully.
It was really exciting to see your response there to some of the points.
Yeah, I know. It's physically and facially very difficult to restrain myself. But you have to give the due respect to the token man on the panel. And also defer to his young age, presuming he's young. I'm 49. How old are you?
34.
34, not that far off. So I'll wait for my turn.
Okay. So yeah.
Is it my turn? Okay.
Yeah. So now that brings to policies and
So let me first level up in this room. I'm not here only because, of course, Suhani knew my role as a policymaker and met me at the World Economic Forum. And that's why this lovely lady here is continuously goading me to speak, because I serve as the B20 co-chair in South Africa for digital transformation. There are 3-4 presumptions and biases, and pardon me for saying this, that you're doing this entire conversation on. One, that the only people who affect a woman, her agency, are men in the family. The family unit is not only limited to men. The second presumption that you're suffering from is that only young men are the harbingers of change. Now, this is what I call inertia of old narratives. The third presumption and bias that possibly this conversation suffers from is that this is a global south or predominantly Indian problem. It is not. The fourth bias that you suffer from is that there has to be the existence of role models to bring forth change. Anybody who waits for a role model cannot be the harbinger of change, because not only is change a constant of life, but if change always waited for role models, you would not have a Mahatma to talk about. So now ask me the question. Oh yes, another context to me. Apart from being a policymaker, I'm 49 today. At the age of 17, I used to sell cosmetics for $2 a day on the roads of Delhi. I'm the first girl in my family to work. I'm the first girl in my family to own my own capital assets. So I come from being dirt poor to, yes, now being listed as somebody who's worthy to sit on this panel. So what I will speak will be from experiences which are not colored due to distinction in office, which is not colored because now I have money, because there was a time when I had none. Yes.
Yeah. So, ma'am, to make this shift be widespread, what specific policy gaps or untapped strategies do you believe would be most effectively accelerate progress on role of men in championing women's health?
Firstly, we need to recognize again that the dichotomy we live in is that it is not only men who stifle growth. Let me reiterate why I say this and let me evidence it. Instead of creating more fissures, let's have conversations that can bridge the gap. It is not a young man who helped bring to fruition a legislation which gave women the right to medically terminate a pregnancy at 24 weeks in India, a legislation that was waiting in the wings since the 1960s. It was a 74-year-old man who brought that legislation. It was not a young man who stood at the ramparts of the Red Fort to say women should have access to a sanitary pad at 1 rupee. It was a 74-year-old man. It was not a young man or a woman in high office who ensured 33% reservation for women in Indian Parliament. It was a 74-year-old man. So the bias or the presumption that change can only happen by men who are young is something that I don't suffer from because I've seen evidence. Today in India, we have close to 400 million women who are of the working age, 323 million women who work in the informal sector. But how do you look at the informal sector? The differentiations between the informal and the formal sectors are from the presumption that women who are in the informal sector will not have medical benefits and cover, will not have insurance, or will not have pensions. That is a presumption, and I'll defer to the professor of economics to my right for all that needs to be fact-checked. Now, in India today, we have 130 million women who are informal in their vocation, however, are part of the insurance and pension schemes. Today, we have close to 48% of women under the 100 million program, family program of Ayushman Bharat, which gives you access to 32,000 hospitals across India. 48% of all hospital admissions, and the number is 36 million women have received hospital admissions for across 1,300 diseases, including surgeries, under that program that is evidenced, woman by woman, experience by experience. 240 million women have gotten themselves screened for the cancer of the breast and the cervix, which means all these women who wanted to leverage their agencies with regards to health were waiting for an instrument which is funded, which is provided for by government, so that irrespective of the men in their family, they could have and create access. So while we're talking about championing the women's agency, we also need to factor in what happens when, irrespective of the role of men within a family unit, that if you have the access, if you have the opportunity to gain some support in the healthcare sector, how does that impact your life? There are many who presume that in India, when you talk about the LFR, the labor force participation, one needs to also reflect on who are the women who are not counted. So let me give you a small example. 90 million women in India work in self-help groups. Their average business every year is close to $37 billion. They have received from the Indian Treasury in the last decade 8 lakh crore rupees. And the fascinating part is that their NPA on the credit that they have taken is less than 2%. It is evidenced. 10 years ago, women had only 28% savings accounts in banks. Today, 250 million Indian women have a bank account, but it's 300 million women from rural, semi-urban areas who went up to banks, gave them a business plan, got a collateral-free loan, serviced their loans, paid it back, and I'm proud today to say that when these accounts were looked at, it was found that one, NP on women-owned businesses is below 2%, NP on male-owned businesses is about 2.5%. What banks found after 10 years of research across all accounts was that a bank earns a lifetime revenue of 12% more from a female account holder as compared to men. And this is happening in India. So to deny that women sometimes, irrespective of the role of men in their families, have the capacity to take ownership is genuinely to deny evidence which can be economically and very progressively being offered for scrutiny. How do I say this as well? I, as minister, created the world's largest nutrition tracker, which currently has 100 million beneficiaries, 25 million women who are pregnant and lactating, and 75 million kids who are under the age of 6. Supplementary nutrition, when it's given at their doorsteps, vaccination calls that are made, we do reach out to men, and men do turn up many a times. Those who don't, well, you have that challenge in geographies which are not limited to the global south. Let me contextualize it from the perspective of history in terms of the geographies that we belong to and we are currently sitting at. Back home, I have a president who's female. Back home, when I celebrate my constitution, I know it was written by 15 women. Back home, yes, I do not say we live in a utopian age, but neither does everybody else across the world. The irony is there's a presumption that if you are an educated man, you would know better. So when you talk about creating spaces where, let's say, in corporates, you will have women have a larger agency, who are the ones who are denying it? So I think the dichotomy, and I'm flummoxed by the fact that educated men who become leaders within a corporation then deny equal pay for equal work, which means for decades we were told education is the problem. Now it seems it's not.
Yeah.
And what is the reality today? We are living in the age of AI. Only 18% professionals in AI are women. 29% of all STEM-based jobs across the world are women. But look at India and look at the CEO number. We have close to 8% women who are CEOs in India. The global average is 5.6. So while we, yes, talk about what happens to a man in a family and whether he cooks for those 5 days or doesn't cook, my issue is, can we look at what we are doing right and also talk about those issues? For I recognize that there is a lot to celebrate when things go wrong, to say, oh my God, and misery will beget a lot of financial support. But the issue is, so shall I think we should put that out there. Why can't change find money for impact? Why should misery always have conferences and not positive change? So yeah, that's why I was fidgeting.
Ma'am, next question. From your vantage point in government, how can public agencies, private sector companies, and civil society groups better collaborate?
So let me give you a heads up. I'm the minister who was in charge when I not only helped write the national education policy, but when the Prime Minister of India spoke on the 15th of August in the year 2014, let's build toilets separately for girls across all schools of India. I was the person in charge. We built 400,000 plus toilets across the world, across India. But guess how many people showed up to fund it from the private sector? 99% of it was built by government. Not even 1%, 0.5% was built by somebody. I just had the last 40,000 toilets to build. I was running against time, so I called a female colleague in the private banking sector. She's now received a Padma, which is the highest civilian award in my country. Her name is Arundhati Bhattacharya. I called her in panic to say, I have 40,000 to build. And that's the networks that we need to actually talk about. I called her, she said, on it. But the presumption that the private sector will suddenly stand up and rid you of all your misery, no, it's the government, at least back home, which banks were always around in India. How come 550 million Indians not have a bank account? Lending agencies were always available in India. How come nobody thought of this methodology of doing collateral-free loans? Health institutions were always available in India. How come nobody thought of creating a network of health institutions and then creating access? How come nobody thought of creating 10,000 stores where you can get pharmacy support, where you can get a sanitary pad for 1 rupee? And why did we have to wait for 6.5 decades for that how come to happen? So I think those are the instruments. If I just looked at those who bring change, are they young? Are they men? Maybe they won't bring change. I will suffer a bias and stifle that growth. And the more we create this fissure, the more we stifle opportunities to collaborate. So yes, there is evidence that podcasts where you're telling men to change will only be heard by women. But that does not discount opportunity to have a sit down with men and have a conversation. Yes, I have a father who said the best thing you can do when I was 16 was to get married. But I don't grudge him that. I don't demonize him for it. I said, yeah, I know that. That's coming from a perspective of fear. That let my daughter just have a home and a partner who can physically protect her. I won't be around. You don't begrudge that generation that value because they didn't know better. You sit down with that generation and prove a point that yes, I'm a nobody, but I can be a somebody. And that's how you heal. That's how you bridge the gap. You don't need to light a fire everywhere, but you can light a fire only to light up a path. So I'm from the perspective, and like I said, I have lived that life. Yes, there are men who are beating down women. But is it only happening in slums? And it's only happening, let's say, in the global south? And we were told that if men are educated, they won't beat down their wives. We were told if women have a job and a check. So I think that instead of making a position very nascent, that this is the truth for all women, let's actually open it up for those women who said, yes, I met with a challenge, but I knew how to find solutions. Yes. And then I could affect change. Maybe a role model, maybe not. But we need to recognize role models come with feet of clay.
Yeah. I think that was a very complete different
I know you
perspective
got an
that you gave.
indication from Sohani to move on, so move on.
Yeah, I'll just shift to Zubida. You bring years of grassroots experience and have seen the shifts unfold in real time. So, from a civil society standpoint, how can organizations like Grameen Foundation foster support systems at home and in community that enable women to improve both health and employment outcomes?
Correct. No, thank you. And I know I'm kind of running short of time, but I appreciated everything that Ms. Irani said. You know, the mere fact that this room is majority women kind of troubles me a lot. And for decades, I've been in room talking about women and empowerment as if we have power to give women. I think the mere fact is that the world has women who are full of power. All we need to do is just get out of their way and not try to fix them. That's the role of civil society, I feel. I come from a background in mechanical engineering, and I look around and say the door that I opened this morning to enter is not designed for a woman. The chair you're sitting on, the chair I'm sitting on, is not designed for women. The world around us was meant for men and designed in a way that patriarchy was out there. And it was not just men holding patriarchy, it's women upholding that patriarchy. When I design products for women, I always think about, well, what is it? Why is this designed this way, right? I remember being in a sugarcane farm in India about 15, 20 years ago, and I would go to these women and say, how can I design a detrashing tool for you? And these women would say, we are forced to remove our uterus to come to work so that we don't have to take breaks. What can you do about it?
Yeah.
Right? So we never asked these women questions that needed to be. At Grameen Foundation, the biggest issue we saw was, yes, we created this microfinance movement globally, but these women were being charged higher interest rates than men. They were never given the full amount of capital that they asked for, and almost always the loan would be taken but distributed, as Rohini said beautifully, amongst the family. If you give a woman a phone, she's going to give it to her son, her daughter, her husband. She's not using that asset. How do we change that? And at Grameen, we have 3 simple approaches that we have started implementing today. The first one is what we call the household dialogues. We actually train a local agent that understands the family, the culture, the values, to go in and have a conversation within the family to say, how can we distribute power within all of you, right, including this woman? Because we know data that shows, as of by ILO as of last year, that women globally provide $16 billion of unpaid care work every single day. Every single day we are holding. And this is not an India or a US problem. If you want to understand India, read this book, Chup by Deepa Narayan, who talks about how women are groomed to believe that they are invisible. And if you want to understand US, read the book called Holding It Together, how America is how women are America's safety net. We're actually holding with our unpaid care work America's economy in a way that we don't want to make visible and make understand. Right? So when we have this conversation, the biggest success that we saw was allowing women to sit with the family and have meals with the family at the table. And if these women are pregnant, their nutrition uptake goes up by 70%, just by the mere fact that they're sitting with the family and not eating after the family, right? When all these people understand the burden of care this woman faces before she steps out of the house and agree to do that, you know what happens? The financial institution considers her less risky, and thereby her interest rate goes down. When we talk to men, exactly, men are not bad people. Like, I'm a mother to 3 sons. I have to be cognizant of the fact, and I speak to the world about why gender is important and why role of women is important. I balance it out, but the important thing here is men feel threatened by a woman's financial independence. That's because they're groomed to believe that way. The minute you have a conversation with these men, and we've seen with 3 conversations, you can make a man understand that he has peers to support him, and that allowing a woman to bring in money is not a threat to his masculinity, because 70% of all gender-based violence and domestic violence happens because of financial reasons. Doesn't matter if it's in the US, in India, or Africa. A man is threatened by her economic independence because he's groomed and raised to believe that he's the sole provider. The minute you can dismantle that myth and enable him to have a peer and a support group that will not look down on him for supporting a woman, then he is successful. And that's our Male Champion program that's been very successful in India and Nigeria. And even in Nigeria and northern Nigeria, we are seeing polygamous marriages where men are stepping up and saying, maybe I made a mistake by having these 3 wives. Maybe. I should change this in my future generation, right? So just having conversations and understanding that we need to fix the issue and not the problem is a huge success factor. And I'll stop there. I think we really need to understand that patriarchy is rampant. That's everywhere around us. It's in, even in the jeans that we wear, it doesn't fit our mobile phones because women's jeans are designed for men. It's not designed for women, right? And so for us to understand that our everyday life needs to change and we need to show up as individuals. You don't need role models. You don't need successful people to follow. You just need to change yourself and everybody around you. And those simple changes are going to be cumulative. And the last aspect for me is AI, right? The biggest fear for me today is these biases that we hold every day are being fed into a system. Yeah. And we need to act now for us to be able to leverage such a technology at scale to not just enable men or women, but to enable us as a society so we can all be successful.
Zubeda, that was really powerful. Yeah. So I'd love to open the floor to all of you if there are any questions to the panelists here. Yeah.
Thank you so much. Incredible panel, and love the perspective from everybody. So I host conference for moms in India, in fact, something that has started post-COVID because I'm like, how do we make the shift? Like moms are not coming with manual, they're thrown into a system, and there's social conditioning and even including their own bias that they feed themselves that makes it challenging. So I took it upon myself. I live in Florida, by the mom of 3 boys as well. So I started the conference. And one thing that we noticed is that you were talking about men. When we put it out there in the newspaper, we had men calling, saying that, how do I send my wife there? Because, the conversation we were talking about, everything, including parenting, relationship, nutrition, getting back to workforce, pretty much covering everything because through my years, I've been mom for like 14 years now through 3 boys, and constantly I'm surrounded with moms, and those were the conversation we were having. And we're like, all right, we need a space just for moms. Now, women conversation is one thing. When you talk about mothers, they are the change maker and they are the one setting the future. So when you were talking about the next generation and, how do we make the impact? And nothing is instant. Everything is very subtle change. I feel mothers are in a position where they could create the next generation. Now, even with my 3 boys, that's the conversation we have. Because soon, the way they treat their spouse, eventually, it all starts from me, how my husband treats me, and now he's an equal partner. Now, he was born and raised outside, like he was born in London, raised here, but then I'm like, how about men in India who are being conditioned otherwise to be like, no, it's women's job to, raise children. So I think that's something that I wanted to kind of add upon, and I love that such panel and such summit is really important. So I feel like how do we come together between the government, organization like yours, and everybody to have this conversation in one place? So
I think that one aspect, and just taking from what Zubeda said, in terms of technology and design flaw, as a mom, I think we need to bring out more and more attention to certain design flaws which are deadly. For instance, where it speaks about, let's say, the age of AI. In AI, and whoever uses AI for car safety in the automobile sector, they always take the body shape of men, never consider the body shape of women, especially pregnant women. And now technology, and there's a BBC report on it, which showcases that in the same circumstance, because AI doesn't take into consideration the female body type, women in the same accident are 17% more likely to die than men. So I think that certain conversations need to be acted out, and there has to be a global opinion created on them. Because one is the issue of families and moms and the role of men within those family units, equitable distribution of power, as Zubeda says. But the others are urgent red flags that need to be addressed today. Another issue with regards to moms, or for that matter, how AI relates to the same, and the agency of money. Today, 33% and less chances exist of women who are on the internet, especially on, let's say, Instagram, or any other e-commerce platform. You are more likely to get less information on investments. And you're supposed to get 70% more information on how to sell on FMCG goods. So I think that there is a need, and that impacts the everyday utility, the everyday impact of money with regards to family. Those are the red flags that need to be called out pretty soon.
Yeah. Yeah. I'll pass it on to you. No, I think just one more last thing.
Hi,
Okay.
sorry. Awesome discussion. Quick question here. During the morning, we've had lots of presentations and a lot of data you shared as, I would not say the token male member, but representing mankind here. A lot of what has been shared is what we've known for years. So is academia keeping up with societal change? Because what we're looking at, we're at an inflection point where the conversation is not about how do we get women into the workplace, but in the US, as the global leader economy, the big driver of change is going 30 years back. So do we think we need to do some research to understand what are the triggers, why is that happening, what are the biases? Because research right now almost feels like it's 20 years old versus where we need to be now. And I come from the private sector. To your point about AI, 0.2% of AI patents are held by women. From an investment perspective, we have an investment portfolio of about 200 companies. We had one female founder and we impaired the investment, which basically means we had to write it off. What is the gap? Why is the gap? Should we not be doing lots of research into understanding what is mostly relevant today and why societal shifts are happening now? Sorry, quick question for anybody who wants to answer.
Professor Myna, yeah.
I'll briefly say that we're lucky that our colleagues, especially in political economy and political science, are extremely motivated to figure out what's going on right now. And I think what emerges, I think, a lot from this debate is that economics and incentives are fundamental, but politics is also extremely important. And so we're fortunate that we have collaborations between all these angles. And
I also feel there's a huge disconnect anthropologically and sociologically between how the global north views academically the global south, because the templates are set by the global north. And I think that we are at a precipice of time where we can become the glue stick between the north and the south, because we have the institutions of the north and we have an understanding of the south, and that's where the answers will come from. Because if the lens is not from a perspective of understanding the diversity that we live in, if that perspective is not understood, I don't think research will throw up something new. And that is why you see the rigmarole of the old.
No, 100%. And I would like to point out to Dr. Rohini Pandey, who's actually been doing amazing research, not 20 years behind, but as it stands currently today. And there is very little funding available to talk about women. And like Ms. Irani was saying, the research around kind of seat belts and airbags and how they're not meant for women, I think that's been in the last 5 years is where it hasn't even come to implementation. It's just in the research phase. So I think we're really behind in terms of understanding that we want to acknowledge that women have been treated as invisible and that we really need to bring that voice at the forefront. The more we start dismantling patriarchy as men and women in the world, the more we'll see research that is more relevant and to date. But I would say that it's still happening currently. And there are many amazing researchers doing that, but it's very recent. We're not going back to the 1960s, but we are 20 years behind because we're still understanding the presence of women and the need for it in the workforce. And that's kind of where the disconnect might seem like.
Yeah. Thank you so much. I know there are more questions, but we're really running short of time. And thank you all for being here. Thank you, amazing panelists, for such deep insights into this. Thank you so much.
Finally, it's over.